Step inside a modern, mid-size medical clinic, and you will see the same scene. Staff members are caught in a constant physical sprint, shifting their attention second by second between ringing desktop phones and a growing line of impatient people. On paper, patient registration sounds like a straightforward administrative task. You collect demographics, verify the insurance, and update the electronic health record. But attempting to execute that precise sequence of data entry while managing the noise of a live, unpredictable waiting room makes errors inevitable. The manual process is heavy. Veradigm research shows that manual data entry consumes 15 to 20 minutes for a single patient. Over a full schedule, that eats up hours of staff capacity. When the front desk backs up, the administrative overflow moves upstream, forcing physicians to spend over 7 hours a week managing paperwork instead of practicing medicine. This illustrates the staffing spiral created by that environment. According to the Medical Group Management Association, 53% of practice leaders now rank finding qualified staff as their single biggest challenge, a problem fueled by an annual front office turnover rate between 30 and 40%. That high churn rate functions as a silent, continuous tax on your operating budget. Every time a burnt-out medical assistant or front desk receptionist quits, industry benchmarks indicate it costs the practice between $9,000 and $12,000 just to replace them. Treating patient registration as a high-volume hiring problem misses the mark. Continuously recruiting new people to execute a slow, manual process in a distracting environment ensures the operational friction will continue. To understand the true cost of that friction, we have to look past the waiting room and check the back-office revenue cycle. A typo at the front desk does not stay at the front desk. The CAQH index establishes a baseline claim denial rate of 12% across the medical and dental industry. When Experian dug into those rejections, they found over a quarter of them originated from inaccurate or incomplete intake data collected on day one. A major driver of this is the eligibility trap. A clinic will verify coverage over the phone when an appointment is scheduled weeks in advance, but they lack the bandwidth to re-verify it on the actual day of service. By the time the patient walks in, their plan has terminated or their employer has changed, and those silent errors begin to accumulate. This workflow pipeline tracks the exact financial penalty for those front-end mistakes. A single demographic typo leaves the clinic, fails at a payer rejection gate, and terminates in a $285 penalty. That is the average cost providers absorb in delayed payments and manual rework for every eligibility-related denial. Attempting to prevent this with manual phone verification is entirely inefficient. Sitting on hold with an insurance carrier takes up to 45 minutes and costs the practice nearly $7 per transaction. Electronic processing, by contrast, is virtually instant. The data shows that front desk data integrity directly controls the final profit margins for the entire practice. To stop the financial bleed, smart medical groups are executing a structural pivot. They are pulling the registration function entirely away from the physical front desk. The solution replacing it is the Staffingly model. It provides a dedicated virtual team that handles your registration workflow synchronously, directly inside your existing electronic health record system. Look at this split-screen comparison. On the left, we have a chaotic workflow dictated by phone calls and walk-in interruptions. On the right, a dedicated single-tasking operation removes those physical distractions, creating a clean data funnel that eliminates the root cause of intake errors. Because this virtual team focuses purely on data integrity, they can execute real-time electronic eligibility verification for every single encounter. The transaction processing time drops to under 60 seconds, and the cost falls to just 34 cents. Applying full automation and dedicated focus at this specific step achieves massive results, slashing eligibility-related claim denials by up to 65%. By isolating a detail-heavy task from a chaotic environment, you naturally drive out the data entry errors that cause downstream friction. The scalability of these outsourced teams relies on a powerful underlying technology layer. The humans do not work alone. The system utilizes AI document intelligence to automatically read and categorize patient intake paperwork, accelerating processing speeds before a human specialist even begins their manual review. It also features a predictive error prevention system. By analyzing historical claim mistakes, the software builds custom safeguards into the workflow, blocking recurring demographic typos and invalid payer IDs before they can be saved to the record. Practice owners can monitor all of this through live analytics dashboards, providing real-time visibility into the registration team's performance metrics minute by minute. This AI quality control layer acts as an active financial firewall, protecting the practice against expensive payer penalties. Let's look at the hard numbers. When we run a direct financial comparison, the expense of the legacy system becomes impossible to ignore. An in-house registration coordinator's total cost, including a $35,000 salary, taxes, benefits, space, and turnover, reaches $60,800 annually. Staffingly's dedicated model includes benefits, backup coverage, and EHR integration for a flat $21,600. That bracket reveals $39,200 in immediate savings. That represents a 64% cost reduction for every single registration position in your clinic. You lower your fixed administrative overhead while simultaneously insulating the practice from the high costs of employee turnover. Switching to this model is rapid. The virtual team can complete integration and go live in just 48 to 72 hours. The infrastructure is fully enterprise-grade, carrying rigorous HIPAA, SOC 2 Type 2, and HITRUST certifications. It is a proven system, actively operating across more than 800 medical practices nationwide. Practice administrators can test this workflow inside their own electronic health records, utilizing a 2-week risk-free pilot, requiring 0 long-term contracts. Outsourcing the registration workflow stabilizes the front office and secures the revenue cycle, solving the primary friction point that holds back clinic growth.